Diabetic foot ulcer. A diabetic foot ulcer refers to a skin wound characterized by complete skin thickness loss on the foot resulting from neuropathic and/or vascular issues in individuals with either type 1 or type 2 diabetes mellitus. Severity of diabetic foot ulcer. In this image, we can see different grades of ulcer: grade 0, grade 1, 2, 3, 4, and 5. And as the grades increase, the severity of the foot ulcer increases. In grade 0, there is no ulcer. The only symptom present is pain. So this means that the skin is intact and the ulcer is about to develop in this case. In grade 1, the ulcer formed is only present superficially, which means that it is only involving the superficial epidermis, not the dermis. In grade 2, the ulcer has gone deep, involving the tendon, ligaments, and capsule. Now it is eroding the deeper parts. Grade 3, the ulcer is deep enough to affect the underlying bone. So you are also going to see the bone. Grade 4, half of the foot has become gangrenous. Now when a foot is gangrenous, this means that blood supply to part of the foot, especially the toes, has been cut off as shown in this image. So you are going to see blackish discoloration. In grade 5, the whole of the foot becomes gangrenous, and in this case you have to amputate the foot. Did you know diabetic ulcers are the most common foot injuries leading to lower extremity amputation? Hence, it is important to know how to avoid foot ulcers. You can take certain precautionary measures like maintain your blood sugar within the target range by monitoring your diet and tracking blood sugar levels. Quit smoking as it can negatively impact blood flow and exacerbate foot issues. Avoid going barefoot and protect your feet by wearing well-fitted shoes made of flexible and breathable materials like leather or cloth. Inspect your feet daily for blisters, cuts, cracks, or sores. If you can't see well, use a mirror or have someone help you. This last point is very important because usually the diabetic patients do not feel any sensation in their feet because of diabetic neuropathy. So even if anything strikes the sole of the foot or it injures or ruptures the skin from that part, the diabetic patient might not feel it. That open wound will get infected over time and can develop an ulcer with pus inside it. This infection can also lead to sepsis, which means a condition in which the infection has spread to different parts of the body. So it is important that you tell a diabetic patient to look at their feet at least before going to sleep, so they do not miss out on any small blisters, cuts, cracks, or sores. If, however, you do develop an ulcer, you should know how to take care of your ulcer at home. Stick to your physician's guidance on relieving pressure from the foot ulcer, which may involve using crutches, a wheelchair, wearing a cast, or using a walking boot. So simply means that you do not have to apply pressure on the already damaged area. Follow your doctor's instructions for ulcer cleaning and bandage changing. If antibiotics are prescribed, take them as directed, completing the entire course even if you start feeling better.